Excellent. We'll move on to the treatment of osteoporosis. I understood, obviously as an orthopedic surgeon, about calcium and taking vitamin D and getting sunlight.
Very important.
And that's about as much as I knew. I've heard about biphosphonates in the last few years, but when you look at it, there's a lot to it. There's so many different forms of treatment.
Yep.
If we start off with the simple things first, obviously preventative would be important.
Yes.
Reducing alcohol intake and doing exercise.
Yes.
Where do you go from there?
Yeah, and look, I'm glad you brought up exercise. It's actually really important to also prescribe the type of exercise that should be done. A lot of the patients that you take a history from will say, yeah, I walk every day, and walking's good. But if they've already had a fall and a fracture, we really need to be looking at what more we can do for these patients. And Healthy Bones Australia actually has a really nice PDF, again, about exercise, and they cover exercises for weight bearing. They also cover resistance training and balance training. So these are the three sort of categories of exercise. And balance training is really important for these patients, especially the ones who are falling over, just ensuring that they can right themselves better if they trip and things like that. And I think exercise physiology referral is absolutely reasonable as well. So with regards to finishing up on the lifestyle things, I guess I always make sure that patients are having adequate calcium. So the recommendation is at least 1,200 milligrams for a postmenopausal woman per day. And that can look like different things. I usually have a little chart of calcium foods, and there's also online calculators that people can use to make sure they're getting enough calcium. And vitamin D, I think labs quote 60 as the normal range, but we know that you sometimes need up to 80 to completely eliminate any sort of bone resorption that's going on. Yeah, and most of us need vitamin D supplementation. We're all indoors. So that's we've covered the lifestyle things, the dietary things, and then moving on to pharmacological management.